Hello again, 2 videos, same night. I figure it's gonna take 4 hours for one video to upload, so I might as well get some recording done in the meantime while I wait. So this video is going to talk about, well, I really want to touch just slightly on neurotransmitters. So there are 3 common neurotransmitters you will hear about when referring to mental illness. They are serotonin, dopamine, and neuroepinephrine. They are the 3 main ones that are generally talked about. What I do know about neurotransmitters from research that I've done is that a lack of serotonin in the brain, in certain parts of the brain, can cause different mental illnesses such as depression, bipolar disorder, OCD, and other various issues. A lack of dopamine causes Parkinson's syndrome. Too much dopamine causes schizophrenia. Not really sure about neuroepinephrine. I know that it plays a pretty big role, but when you have depression and other types of situations with a serotonin deficiency, you're usually put on what is known as an SSRI medication, which is a term known as selective serotonin reuptake inhibitor, which allows the serotonin to flow through the brain as it's supposed to. I'm not really sure how it works. Not too many people are sure how it works, just because, well, you can't test these levels. These levels are something that are just kind of like guess and check. You try a medication and it works, great. It doesn't, you have to try a different one. So for me, I've tried a couple of different ones, finally found the one that works for me. Really grateful for that. Don't really want to go into that right now. Probably around video 6, I will reveal what medications I take and how they affect me and that sort of thing. But this video, I would like to focus more on treatments for OCD. So the main treatment for OCD is psychotherapy known as CBT, cognitive behavioral therapy, which is a form of psychotherapy that helps to change the way the brain functions and reprograms your thinking. CBT is not something that's easy to do. There are many categories of CBT. For example, one I mentioned before is ERP, exposure response prevention. For someone with OCD, exposure response prevention is really, really scary. I hate to mainstream it so much, but the best way I can describe ERP is to say someone with contamination therapy would be forced to sit with their hands in a bucket full of dirty tissues for like 15 minutes and then not be allowed to wash their hands for 2 hours or longer. That's going to provoke anxiety, a lot of anxiety. And the point is to reprogram the brain to believe that it's not going to make you sick, it's not going to kill you, and they want you to sit through that anxiety, to breathe through that anxiety. Sorry, mosquitoes kind of attacked my face the other day and I'm a little itchy. But you have to be willing to commit yourself to it. OCD is an anxiety disorder. It really and truly is, because everything that OCD does to you makes you anxious. The intrusive thoughts lead to anxiety. Anxiety leads to compulsions. Compulsions lead to a what's a good way to put it? It leads to relieving the anxiety to a certain point. But again, as I used the example in my first video, it's like a cycle. So you've got obsession, compulsion and anxiety is kind of like that gap there in the center. And so when you relieve that anxiety, you feel a little bit better, but then the obsession comes back, which leads you to do the compulsion, which lowers the anxiety, and it's a cycle. It goes around in a circle. And so what ERP does is it helps a person to reprogram the way that they think so that they can breathe through that anxiety and realize that no, sticking my hand in a bucket full of tissues isn't going to cause me to get deathly ill. It basically exposes the person to what causes the anxiety and forces them to face their fears. It forces them to do the things that they feel they can't. So someone with, for example, harm OCD, who is afraid that they're going to hurt someone, they may be told that, hey, while you're sitting on the couch watching TV with your family, you need to sit with a knife in your lap. That's terrifying to someone with harm OCD, because oh my gosh, what if I snap and lose control and stab someone? It does seem a little ridiculous, because why would you put someone who's mentally ill in a situation like that? But a person with harm OCD is the least likely person in the world to cause harm to someone else, because they're so afraid that they're going to cause harm, they do everything they possibly can not to. Another type of CBT, hold on, I need a drink. 1 second. Just hold on. I keep doing this. Boy, 15 minutes goes by fast, and then when I have to stop, my throat's just really been dry. It's all the allergies and everything. But anyway, so another form of CBT is mindfulness. Mindfulness is my personal favorite form of CBT, because it simply makes you be aware of your surroundings. You are mindful of the situation, and you're open to what is going on in your mind. You're observing your thoughts. You're letting them pass through. You're not judging them. You're not thinking about them. You're not focusing on them. You're just letting the thoughts come through. You're just letting them go by, because thoughts aren't harmful. Thoughts cannot hurt you. I could sit here and think, I'm going to, I don't know, I can't think of a good example on the spot, I guess. I'm going to go in the kitchen and make chocolate chip cookies. It's a thought. It's not a harmful thought. It's not a crazy thought. It's not an OCD thought, but that thought is not harmful. What could happen if I go into the kitchen and make chocolate chip cookies to someone with OCD? The stove could catch on fire, or my finger could get caught in the blender, or not blender, but hand mixer. There's just so many things that could lead to it. But thoughts are not harmful. You can't hurt yourself or anyone else with a thought, because it's just that. It's just a thought. It doesn't mean you have to act on it. It doesn't mean that you have to do anything with it. It's just a thought that comes into your mind. And with mindfulness, the idea is to allow those thoughts to pass, and then to live in the moment and focus on nothing else but what's in that moment. So in the moment, right now, I'm recording this video. I'm focused on recording this video. I'm focused on getting my point across. I'm focusing on raising awareness, lessening the stigma, getting rid of the people who are non-believers, who think that it's all in our heads, which, yeah, it's in our heads, but we're not looking for attention. And that's why I mentioned before, how do we draw a line? How do we separate between look at me, to raise awareness? Well, in order to raise awareness, you need to look at me. I don't want you to look at me. I want you to look at mental illness. I want you to do research. I want you to get on Google and type in OCD. I want you to get on Google and type in whatever it is that you're suffering from. I want you to ask questions. I want you to see a therapist. I want you to get guidance and support. I want you to have a good, strong support system. I am blessed. I am fortunate. I have an amazing support system. I have my husband and my children and my parents and my friends, and they all know, excuse me, they all know what I go through. And they all know the hell that it's been on me, and I realize that there are people out there who have suffered much longer than I have, and it's been much more debilitating to them than what I've dealt with. And I'm lucky enough that just over a year I'm medicated and feeling better. Some people can't do any of these types of therapies without it causing severe anxiety. So you have the options of finding a licensed therapist, a private therapist, to work with you on these things. Find someone you're comfortable with that you can trust. I have been seeing the same therapist for going on 6 years because I don't just suffer from OCD, I also suffer from post-traumatic stress disorder as well as some depressive qualities. OCD was just a sudden onset, but that's just me. I was lucky enough that I was already in therapy when OCD onset happened to me and was able to bring it to my therapist's attention after trying to just harbor it in and basically just felt like I was going crazy. So a therapist will help you explore ways to deal with the anxiety, and CBT will be the first thing that they mention, and don't run away because it can be an amazing thing. If you don't feel like you can do these things, I highly recommend finding a psychiatrist that you can sit down with that will listen to you. My psychiatrist actually listens to me. This is something you find every day. I'm very fortunate in that as well, and I do thank God for that. I'm a prayerful person, and he placed a psychiatrist in my life, a private psychiatrist that I absolutely adore, and he was able to medicate me, and those medications are helping me so that I can do the forms of CBT that I want. Right now I'm working on mindfulness, and the medication allows me to do that more than I could ever do it without the medication. It's helped to alleviate the symptoms for me so that I'm able to do what I need to do so that eventually at some point hopefully I won't need medication. If I do need medication for the rest of my life, then so be it, because I'd rather feel this way than the way I felt a month ago. I don't like the idea that people are out there suffering and that they're clueless and that they have no idea what's going on. That's why I'm doing this, to raise awareness and to remove the stigma, I guess is the only word I can come up with at the moment, behind it, because there are a lot of non-believers out there, people who think that it is just a cry for attention. It's not. It's real. It's in your head. And if they could suffer for even just 5 minutes with what we go through on a daily basis, then they would be the ones going, oh my gosh, I'm so sorry. What can we do to help? What can we do to change this? What can we do to get better mental health care in the situations that these people need health care in? So I'm going to close now. Subscribe, comment, like, all that good stuff. Ask questions, please. And above all else, research. Look it up. Do the work. I did, and that's why I'm here, because I did the work. Also, just briefly want to mention, I have about 1 minute left. I am a psychology student, and I do hope to help people one day with this. I want to reach out. I want to help people. And that's why I'm a psychology student. I'm working on hitting into my, well, Tuesday I will start my second semester. So, I'm not 100% well versed in it all. I have no licenses. I'm not a medical professional. I'm just a student, and I'm a person who suffers on a daily basis. And there's no reason why we all have to suffer alone. We're all in good company. We just have to admit that we have a problem and then do what we can to address that problem. So, until next time.